try not to get too worried about it, because worrying itself is going to or can increase those symptoms. Now, I know it's not always effective to tell somebody who's worrying, don't worry. But really what I'm trying to do is be reassuring that a lot of these symptoms are going to get better. I think really the most important thing to be aware of is that the vast majority of people will get better, and will get better fairly quickly. The important thing is to not let the fact that you're having these symptoms become an additional stress for you. It's a normal response to having a concussion. And then there are a variety of common sense kinds of things that you can do to help. So one is be aware of the environment that you put yourself in. I find that a lot of people who put themselves in situations where there's a lot of loud noise, a lot of bright flashing lights, a lot of overstimulation, if you will, often experience a worsening of symptoms in that environment. I don't mean to imply that it's making the injury worse, merely that you become more aware of some of these changes that we've been talking about. Insofar as you can get a normal sleep pattern going, it's really important. We found that people who are able to get a good night's sleep tend to recover more quickly. But again, don't worry if you can't sleep, because having disrupted sleep can be part of the injury initially. It's going to get better. The idea is to try and not fall into the trap of worrying more than you can help yourself, or being aware of these symptoms. Regular food and healthy eating, again, is helpful for people. But overall, the idea is be confident and be hopeful that these symptoms are going to get better, because in the vast majority of people, they do.